people at the heart of this project are really our patients, and that's men and women who are detained within police custody. And we provide health care to those men and women whilst they're here. Right at the heart of that is the fact that they are quite disenfranchised, marginalised people in society, and as such very vulnerable. And some people have quite a fear of authority because of the lifestyle choices, poor choices that they make, and don't engage well with GPs, other nurses, mental health services, and sometimes their lives are just too chaotic to make those engagements. So those are the people at the heart of it who really, it's part of the health inequalities agenda. They're not as well as a counterpoint in normal society of the same age. So they're at the heart, but obviously the people that make the project work are the nursing staff here for our service, the police who facilitate access to essentially their detainees and have supported this, and the people who we refer to, which is SACRO. And these are the agencies and the people who are at the heart of Sunday Choices. Before I became lead nurse here, I worked as a clinical forensic nurse. We work 24/7, 365 days a year. And it would seem to me that if you are working over the weekend, which nurses often do to continue continuity of care, you start working on a Friday night, you see a fellow come into custody, they're wild, raging with drink, and their liberty's been taken away, they're not in good shape, and you start working them up regarding their risk, are they okay, have they overdosed, are they fit for detention. Then it comes into the following day, I might be a bit shaky, requiring some sort of prevention of further future withdrawals. You start getting nutrition and water into people. There's a time for reflection, if you like, because you are literally locked up until Monday. What I noticed over working weekends was by Sunday, people were looking better, communicating more freely, they looked less toxic, and they had received their medications, which we give. We were very, very early interventions here regarding this sort of thing. And a significant minority of people would say to me that they were ready to engage with services to actually try and get to the bottom of why they were living this life and the addict's life, and try and change that. But as I said before, it was really hard to facilitate referrals to ordinary agencies, even low threshold agencies, because there's so many rules of engagement that I wanted them to have that opportunity. But it was a Sunday afternoon, and the services that I had identified that would be able to help this process, buddy up, etc., didn't work on a Sunday. So ergo, we have a need. The whole world is talking about health inequalities, working in silos, joining up care between social care, health care, third sector, difficult to reach people, etc., etc., etc. So why not move that agency into here on a Sunday? And it was a really simple hunch. From SACRO's point of view, there were a lot of hard to reach people that hard to reach because they didn't really want to engage, but they found it much easier within this place. So lots of well-kent faces, as the police say, who are finally engaging with real-time agencies. It made it meaningful. And what made it extremely pleasing for us was when people came into custody and started to ask for Sunday Choices. And that was within a 12-week period. So we know it's hitting the spot. Because we try to be person-centred in everything we do here. Because even though environmentally it's a punitive environment, as a healthcare organisation we want to be person-centred. So if someone's asking for the service within such a short period of time, we're onto something for sure. All of our nurses are prescribers, or autonomous practitioners, and yet, you see all sorts of measurement of our practice in the press or just generally. We don't get sometimes a fair crack of the whip of having our ideas heard and putting our ideas into practice. There are so many hoops to go through. So to be able to get in touch with Catalyst for Change through Queen's Nursing was so important because it just cut out all of that stuff. And it was like, I've got an idea. Oh, really? Write it down on this piece of paper and we'll see if we can fund you. And it was like that. So it was really wonderful to be able to be taken seriously as an innovator and go from, here's my idea, to get on with it in a really short period of time. So as we're all chucked in here together, all of the people who've seen the worth of this project has taken some benefit from it. And I'm not sure if I should say this, but I'm going to, is that one significant player who was early adopter for this is using this experience of Sunday Choices as a police worker in order to go forward for promotion as proof of interagency working. So, that is a significant win for that person as an individual, but it shows you the veracity of what we were doing, because it's got chops, as they say. It's a reality for people.